Namaskar everyone and welcome again. This session is actually continuation of the yesterday's topic where we were talking about colic remedies. We spoke about introduction of a case from Sarkar sir and Cuprum. We learned about Cuprum case. Then we spoke about Polusin and Dioscorea. We continued and we stopped at Dioscorea. So from the point where we stopped at Dioscorea, I'm going to take back this lecture from there again. So we learned about Dioscorea, about the pain, the character of pain, the location, umbilicus, hands grasping and twisting pain, then stretching, and the way patient lies down. These are the key factors of Dioscorea, which you can definitely differentiate from Polusin. Now, when you look at Dioscorea, another point also that you have to remember is now you are watching this acute series, so I hope you are trying to understand the fact that none of the disease comes by its own. There is always a definite cause, and this definite cause is there. So whenever I always say that whenever you are reading a remedy, please read a remedy in terms of identifying the cause. Like suppose you read Dioscorea, you read pulsatilla. Ask yourself why the disease develops in these cases. Why does pulsatilla get pulsatilla disease? Why does Dioscorea gets Dioscorea disease? When you have this thing in your mind, then all the ailments from will be in your mind and it will be very easy to pick up. Okay. So what about the disposition? There's something called as disposition. Means every remedy has got its own disposition. One substance a person eats, nothing happens. Another person eats, he gets disease. So this disposition, there are certain dispositions which are particular. Now, these dispositions could be physical, environmental, mental, emotional, or food. It could be anything. So we have to understand this part also. Now we talk about Dioscorea. So let me share you Dioscorea and let's go into Allen's keynote and look into it. So let's go from Dioscorea. See what is written in the first line. So it is a remedy, of course, digestive powers and all. Flatulence after meals after eating, especially tea drinkers. Now the point is tea drinkers, often subject to violent colic. So people who are habitually drinkers of tea, which are other remedies for tea drinkers? Thuja is one of the remedies. Mainly the Abies nigra, Abies canadensis, the Thuja family is also the entire family which has got a lot of aggravation from tea. So people who are habitual tea drinkers, or you get history of tea drinking a lot, then you can find out, and this is one of the biggest causative modality of Dioscorea. I'm talking in acutes. So we go ahead with this. And when we talk about disposition, let me share you another thing. We discussed about Cuprum, right? Let me show you Cuprum. Now, Cuprum met. Where is Cuprum met? Yeah, let's open Cuprum met. Let us see what is written here. Now, from Dioscorea, we're now jumping again back to Cuprum. We learned about Cuprum from that case, that gurgling sound which is there. I'll show you the symptom where it is. It's acting in Thuja. The other remedies are Thuja and arsenic. So gurgling sound, whenever drinks rolls, right? It rolls. That is the characteristic of Cuprum. But the most important character, like in Dioscorea, we talked about the character of pain where it is twisting, and somebody is pressing and as if twisting the intestine. In Cuprum metallicum, the character of pain is spasms and cramps. So when you think of Cuprum metallicum, you will think of Cuprum metallicum when you will see cramps and spasms all over the body. So patient might come to you with colic, but at the same time, you will see spasm in the jaw, cramps in the muscles, cramps in the calves. He has got periodically having this thing. And the another important thing, as I said, bolds in the italics. So when you see here cramps, spasms and cramps is the keynote feature. It is the kind of pain is spasmodic. Now what is spasm? What is cramp? Comes and goes. Comes and goes. The another DD, the remedy that can be very close to it is belladonna, because belladonna also has got pains which are coming and going. But Like there's a rubric in Fatak. Pain, spasmodic, fleeting away, comes and goes. The only remedy is belladonna. But in belladonna, the intensity of the pain, the suddenness of the pain is the characteristic. So patient will emphasize on suddenness. Patient will say the pain is when it comes, it is very sudden. And then of course you get other features of belladonna about the inflammation, the acuteness, the throbbing, all those things, redness. So that's how you can differentiate. But yes, Cuprum, when we talk about, so spasms and cramps. So you'll find a lot of people, he will say he'll be disposed to cramps, cramps in the muscles, cramps in the legs, cramps in the calves. In the abdomen also, it comes periodically. As it is written here, symptoms disposed to appear periodically in groups. So it comes and then goes. It comes and then goes. Spasmodic, 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 spasmodic. Now, as we learned in Dioscorea, that tea drinkers, disposed to tea drinkers, the disposition. What about Cuprum metallicum? It is written here, mental and physical exhaustions from overexertion of mind and loss of sleep. So loss of sleep, the remedy that we always think about is nux vomica and cockles. Like sleep loss, anybody who has done late night duty, late night parties, late night works, and then come up with some trouble. Cocculus and nux vomica is the remedy that we always think about, and it really helps, really helps. But at the same time, the another remedy that you can really think of is Cuprum metallicum. So Cuprum will also have loss of sleep, some episodes. So when you, in acute, you go back and you ask, how did it start? As I have spoken in about my acute lecture. So you go back and you find out, and then you find, okay, there's a thing where there was a situation where he was awakened in the night, he had to sleep, not sleep in the night, and there was a lot of exertion, physical or mental, a lot of exertion, especially over exertion of mind, where he had to think, or he was in some trouble, some emotional trauma, some court cases, some fights, relationship problem, and a lot of mind exertion was there. But along with that, one more characteristic symptom, the mental characteristic symptom is this. Now, this is the thing we have to understand. And many times we are not able to understand this part. It is written attacks of unconquerable anxiety. Let us see what is written in boring. We see in class. This is how I always look in different repertories, mathematics. Let's see what is written in class. Causation, separation, pride. Let's start with Alan's keynote and then again I'll come back. So attacks of conquerable anxiety. Let me see in my book. Yeah. See the mistake in the software. It is unconquerable anxiety, and this made me confused. I said, what is it written? So when you look into the book, Alan's keynote, it is written. Always, that is why always keep your book in front of you. The software, there could be a lot of mistakes. Attacks of conquerable anxiety. What is conquerable? Then the thing which can be conquered, which you can win over. But it is not like that. It is unconquerable anxiety. Attacks of unconquerable anxiety means he has got an anxiety. So there's a printing mistake here. So if in Cuprum metallicum can look like arsenic, can look like nitric acid, can look like other all anxiety remedies. But the anxiety that he gets is actually unconquerable. It is written unconquerable means like arsenic you can pacify. The other remedy is something you can do. You can cuddle somebody, you can converse somebody, you can counsel, and then anxiety goes down. Somebody sleeps, goes down, anxiety goes down. Somebody gets companion, anxiety goes down. Somebody walks outside the house, anxiety goes down, or it is manageable. But in Cuprum metallicum, it is unconquerable. Means anxieties that he gets, it cannot be conquered. So it's a very anxious remedy. So now you can think that spasms, cramps, coming and going, what could be the cause? Go back in the past. How did it start? You'll understand that late night works were there, like nux vomica and cocculus, loss of sleep, a lot of exertion of mind was there, physical and mental, but over exertion of mind was there. And then along with that, he's got some anxiety. That anxiety is actually not making him sleep. He's too much worried about something and nothing is relieving. That is what is called Cuprum metallicum. This is how you understand the drug. And even in acute, it is just the matter of pointing 2, 3 pointers and you can just prescribe. Now, when you look at Cuprum metallicum, of course, I'm not going to read about Cuprum metallicum, the remedy as such, but the symptom which I was trying to show you was this. When drinking, the fluid descends with a gurgling sound. Arsenic and thuja, this I told you. So another remedy is arsenic and thuja. Another thing about Cuprum metallicum is it has got a lot of similarity of lacasis. See this, constant prostration and retraction of tongue like snake. They'll keep removing and retracting the tongue. Something is very good written in Boric. So again, you can see in Boric, as I told you, when you read mathematical, look for the bolds and italics. So what is the bold? Spasmodic affection and cramps. You cannot prescribe Cuprum metallicum if there is no history of spasms, cramps. Okay, remember that. Symptom disposed to appear, whatever. Complaints begin in the left side. So you see lacasis. Even when you do a comparative study, you'll find a lot of symptoms of Cuprum and lacasis very close. So you can be confused. Like patient might say, my symptoms started in left side to dominant is there, left to right. You think of lacasis on left-sided remedy. But Cuprum metallicum is also one of the very good remedy. Okay. So that's how you can work. And one of the very important feature, the modality, like we talked about Colucin, hard pressure. We notice hard pressure in Dioscorea. It is about lying or it is about standing or moving about. It's actually about stretching. The modality is stretching. In Cuprum metallicum, they will have betterment. Of course, it is written perspiration, bleeding, but the most important characteristic is cold water. Even in coughs, patient is coughing. Cough comes in spasm. It comes and then it goes. It comes and it goes. When it comes, it is very bad. Then it is settled down. And you will find the patient is drinking cold water. So drinking of cold water, remember this. Now this is very unusual because even in coughs, like patients who cough, they don't drink cold water. They never drink cold water. But in Cuprum, it is better by cold water. So the cramps and other things also, along with that, you'll find too much craving for or amelioration from drinking cold water. They will say, when I drink cold water, my complaints get lessened. So till now, we have studied the 3 remedies, Cuprum metallicum, Colucin in the last, and then continued with Dioscorea and Cuprum again here. Few more remedies, then I'll be winding up the lecture. Like we studied about Colucin, and I told you that there is a disposition about Colucin about anger, humiliation. This is one of the ailments from mental cause. So another remedy which you can think of in colics, especially in children, is Staphysagria. It could be in adults also, but I'm talking about pediatric like Staphysagria. Now, how do you understand Staphysagria? Of course, you can get a history of indignation, humiliation, this and that. But suppose a patient comes and he says, I keep on getting, this colic or pain in abdomen. Frequently, I keep getting. And you find history of humiliation and other things. Then it becomes easy to think of Colucin or Staphysagria. The most important keynote feature of Staphysagria is decay of the teeth. So even in pediatrics, in children who cannot speak much or it is difficult to understand and they are disposed to colics, open the mouth and look at the teeth. Of course, nowadays, a lot of children have spoiled their teeth because of eating chocolates. But if you get history that the parents say that my son or daughter does not eat much chocolate, but still the teeth is getting decayed. Now that could be even in adults also, when teeth are decaying to a very fast rate, even after taking a lot of care, then you have to think why this is happening. This is nothing but anger suppressed. Now, when you suppress your anger, what happens? You clench, okay, but you clench your teeth also. So if somebody is Staphysagria who's being disposed to suppressed anger, traumatized for a long time, entire anger goes in clenching of the teeth. And it is found that decaying of the teeth is one of the indications of Staphysagria. So in children, if you say this, and then of course, retrospectively, you can ask about the anger, about other things, and you will come close to Staphysagria. Another remedy, now we are talking about children. So let me talk about colic of children. The three remedies that you should always keep in mind is Jalapa, Sorinum, and Lycopodium. Jalapa is a remedy. Now, when we talk about pediatrics, especially when we are talking about infants, the number one problem that infants have is colic, and it is flatulent colic. So there's a syrup that we give, colicoid syrup. Every pediatrician gives after delivery. They have to keep it, and which relieves also in many times. Now, Jalapa, Sorinum, and Lycopodium are the three remedies that you should keep it if you have infants. And this can help you. So suppose they're taking colicoid and this and that, and still the flatulent colic pain is not relieving. Here the colic is more about flatulence, okay, gas trouble. Jalapa is a remedy where the child will keep crying day and night. There is no relief, meaning the parents are tired. No relief. In the morning also they are crying, in the night also they are crying. So they keep crying whole day. Sorinum in the night. Sorinum patients trouble increases in the night, and then Lycopodium troubles in the day. So Lycopodium child will trouble in the day, a lot of gas flatulence. In the night, Lycopodium will sleep. In the night, Sorinum will get up. Whole day they will sleep. Night there is bad thing. And then Jalapa, neither the night, neither the morning. Both things are big troublesome. So these are certain things about colic remedies, and of course, we can keep on going on and discuss about the colic remedies. A short video that I try to make you understand how to deal with colics. So you can add on more remedies, like you can add on more diarrhea remedies, like proton pig is there, podophyllum is there. There are more other remedies, but predominantly like plumbum metallicum is also one of the remedy where there is a lot of constipation, there is a retraction in the pail, and you get dark lines on the gums. But these 4 or 5 remedies which I talked about, I think a homeopath should first grasp his hand thoroughly in differentiating colocin, Dioscorea, Cuprum metallicum, Macphos, belladonna, and of course in pediatrics, if you're thinking of in Jalapa, Sorinum, Cina, Chamomilla. Now we talk about Cina and Chamomilla. I can just give you a gist of it. Now you all know about Chamomilla. Chamomilla is also a very great remedy for pediatrics. But Chamomilla, the most important part of Chamomilla is you cannot examine. I have seen a lot of cases of Dr. Gajanand Dhanikar sir, where he goes and examines, and patients are kicking from the leg, and he holds the leg and then he examines. So they will not allow to examine. But one more thing is very important is uncivil. They are very uncivil. Means what does mean uncivil? Uncivil means they do not have civic sense. What does that mean? I have seen in my clinical practices that uncivil means they will use foul language, they will shout, they will yell, they don't care about other things. So when they get disease, they want complete attention. There's growling, screaming, maybe using, if they adults, bad words, it could be anything. That's how Chamomilla is. And of course, carrot desire to be and other things are there. Cina is a thing which is not that violent and aggressive and uncivil like Chamomilla, but Cina is a nagging thing. It will keep nagging. Like you feel angry, you feel annoyed with Cina. Continuous nagging, like the mosquitoes keep nagging. They don't go away, right? That's how Cina is. And of course, in Cina, Cina is a very good remedy if you have history of worms. If you see a lot of worm history, then Cina could be one of the remedies you can think of. So here I end, my dear friends. It was lovely talking to all of you. Small snippets about the colic remedies. It is just a beginning. I've just given you a way to think over it. The books that I recommend is please go and read Colocin chapter from Nash. You'll get a lot of insights from there. Then other books are Allen's Keynote and Colic. So please go and read more remedies, more differentiation, add on to more remedies. And remember the acute, we are specifically talking about acutes. So remember the acute philosophy that we spoke about in the lecture. If you have not seen, go back and see the acute lecture, the philosophy that I have talked about. Keep this thing in mind and see the great results in it. And I'll tell you, colics, if you can manage very well, your confidence will really increase, and that's how we can take homeopathy to a next level, even our practice to a next level, that patient will have a lot of belief in it. So I'm done with it here. Thank you very much.